what is the actual negative reason not to use Benadryl for dementia patients? If the Benadryl does help as far as sleep.
You probably have never heard me talk. I hate Benadryl. Benadryl is just absolutely evil. And what it does is, it's what we call anticholinergic. And so what it does the opposite of what the memory pills do. So the problem with dementia, such as Alzheimer's, is it's a cholinergic deficit. And the Benadryl makes it much worse. And it can make the confusion so bad that they fall and they break their hip. And in general, Benadryl is not supposed to be given to anybody over the age of 65. There's no reason to ever use it. And the problem is every day we see patients who are getting it. It's over the counter, it must be safe, right? And that's what we hear, but Benadryl is just awful. There's a list of drugs, if you Google Beer's list, it's spelled like beer, and there's a whole list of medicines that shouldn't be given to people over the age of 65. Benadryl is on there. There's so many of them, and if you're over 65, you want to know that list, because I can promise you your doctor doesn't know the list. So.
Doctor, does repeated concussions show up on scans and MRIs or PETs, whatever? My husband's had so many of them, and he's been hospitalized 9 times with concussions.
Yeah, so concussions don't show up on scans.
They don't show up like a stroke or something?
They don't, but I'll tell you, there's an institute in Washington that's studying the veterans, and they have some sophisticated technology that could actually develop a concussion. And where the real problem seems to be is if you have a concussion and haven't fully recovered, which is probably 3 to 6 months, and then you have another one on top of it. And so this organization in Washington, which is a charity organization, has done more than our military ever has in trying to protect our veterans. The problem is they could only see about 200 patients a year to go through this sophisticated testing. And that's why when military soldiers have these concussions, they're taken out of the field for a certain period of time. But you may see atrophy years later. We're seeing this in football players now, and you know, it's been tragic because the original scientist in Pittsburgh who described these changes in the brain was demonized by the NFL, made to be a quack. He went to Boston University, which has a huge brain bank, and then it was able to get a little bit more clout, but still every now and again you'll read stories contradicting that. But unfortunately there's not a real test for it.
Yes, I'm confused, and I'd like to tell you why. The full page of the magazine features this week, Pharmacist of the Year makes memory discovery of a lifetime. Dr. Gene Steiner finds this in his patients that they have been looking for a long time, the real cure of memory.
Right. Well, we've cured memory about 30 years ago, and every day we got a new cure. And we've cured Parkinson's disease thousands of times. And unfortunately, people could, publish anything they want, and obviously that's a paid advertisement. It's not a scientific thing. But unfortunately, the reason why, if we had a cure, everybody would be on it. And unfortunately, we don't. But this is America. People could say whatever they want, and the supplements are not regulated. They're not allowed to make definitive claims, but they don't have to show studies like they do with a medical drug. A drug that gets approved in America has gone through rigorous trials, and we know whether it works or not. And even then, sometimes we find out years later that there were problems. But supplements, they bypass that. And one of my patients owns a supplement company, and he sells a drug for male enhancement. And it became he was selling so much. And he said to himself, something's got to be wrong. So he took the drug and he sent it to a lab and had it checked. And it had Viagra in it. And the guys who made it in China realized, look, if we put a little bit of Viagra in it, it'll work and more people will buy it. And so sometimes it's too good to be true.
Are people with epilepsy any more prone to dementia or Alzheimer's?
There's not good evidence of that, but people who have a lot of seizures do develop some cognitive dysfunction, because seizures that last a certain period of time, brain cells can die. But it's not a very good cohort that's been studied very long. And it's a good question, and the answer is yes, but we can't quantitate it at this point in time. So.
I have a question about sleep apnea and how does that affect the memory?
So people who have sleep apnea and you have cognitive issues, you want to get it treated, because if you're not getting enough oxygen at night, your brain's not going to work very good the next day. The problem is if somebody has, mild to moderate stages of Alzheimer's disease, trying to fit them for a CPAP can be quite difficult. But if you have dementia, we always want to look for things to treat. And I much rather have an 80, 90-year-old with dementia than a 50-year-old with dementia. That 50-year-old who has Alzheimer's, there's nothing I can do. That 80-year-old, I could get him off Benadryl. I could treat their sleep apnea. I could get them a little bit more exercise. There's a lot of little things I can do, and it may only make a little bit of improvement in memory, but I can do something. That 50-year-old who has Alzheimer's, there's nothing I can do, and we know it's going to get worse because they have one cause. That 80, 90-year-old probably has a couple of different things going on. So, yeah.
Is there a food supplements, whole food supplements that one can take to help prevent dementia?
So there's really no food supplements. It's kind of what I talked about, a healthy diet and exercising. We've gone back and forth on ginkgo biloba. There was just a study on fish oil that shows that fish oil kind of prevents some brain shrinkage as we go. Whether it actually prevents dementia, who knows? We'll have to follow for 10 years. The best way to get your omegas is through your diets and flax seeds and whatnot. But there's no, if it says brain enhancer on it, don't waste your money. You think about it, in the 90s, everybody who had Alzheimer's got vitamin E. And then we showed increased strokes, increased heart attacks, all these bad things. And now nobody gets vitamin E. And then there was a recent study that showed maybe a little bit of benefit of vitamin E again. So in medicine, everything is cyclical, and it's only cyclical when we don't know what we're doing. When the evidence is clear, the evidence is clear. When there's a little bit of a benefit, and that's the problem with medicine. Anybody who's had cancer and dealt with something, you go to the oncologist and they say, if you take X, Y, and Z, we improve your survival by 50%. And you're like, 50%? And then you ask, well, how long would I live without this drug? And they say, 4 weeks. And then you say, well, how long will I live if I take this? And they say 6 weeks. And that's a 50% improvement. And so you really got to boil the numbers down to discrete quantities that you could understand. Because sometimes we throw around big numbers and they really don't mean a lot. And so.
I'd like to ask about coconut oil and matcha tea.
So the coconut oil was the fad 2 years ago, and it still is. And unfortunately, with a lot of this stuff, there's just no data to support it. And that's not to say it doesn't work. But in medicine, we do the data first, we prove it works, and then we recommend it for people. In supplements, there's no incentive for them to prove it works if they're selling. And so I'm always more cautious, and I was traditionally trained. I'm open to alternatives, but I'm a man who looks at the science to make a decision.
Would it be harmful?
It probably won't be harmful, but if you did everything, you're going to be on a tea, coconut oil, ginkgo biloba. You spend your whole day taking meds. I should have realized we're in Naples with Dr. Perlmutter. There are some people who are gluten allergic, and they have celiac sprue, and then there's some people who have this transglutamine, and they have problems as well, and it's not really gluten. It's a little bit different, and they get the bowel difficulties. Then there's probably a bigger percent that are sensitive. you know, and then there's probably the rest of us. For the average person, it probably doesn't make a big difference. There are probably some people who make a difference. You know, I like Dr. Perlmutter, but I'm not sure it's based in rigorous science. It's based on a lot of observational studies. I come from the land of observational studies in Massachusetts. The Framingham study, you know, is the largest observational study ever been conducted. And almost everything we've ever come out of the Framingham study has been eventually proven to be incorrect. And the problem is you look at observations and you say, these people who took estrogen, oh, look at all the good things that happened. But it's more complicated. And it's so hard in observational studies to conclude, you know, to keep track of all the different variables. There's no question that cholesterol data came out of the Framingham study, but all the stuff about estrogen is good for you came from the Framingham study. Then we did randomized controlled studies that showed it wasn't good for you. And so you always want to look at the quality of the data. I think probably in the next 5 or 10 years, we'll have the answer to your question. Right now it's intriguing, but we don't have the answer yet. And it's easy to be gluten-free today than it was 5 or 10 years ago. But we have a patient who's truly has celiac sprue disease, and she came in with a rash that was classic of gluten, and she swears she had no gluten, and then she brought in one of her vitamins that had gluten in it. And so it could sneak in, and there are a subset like her, she gets a little bit of one pill and she develops a rash, but most of us will probably be okay on a gluten diet.